My name is Lena Hall. I'm a family nurse practitioner student, and I am doing my physical exam of the head to toe. Do I have your consent to continue?
Yes.
Alright, so first we're going to start with the inspection of the eye, and I'm going to look at the sclera, the cornea, the iris, the lens, the color, and the symmetry of the eyes. So as I'm looking at the eyes, the conjunctival ducts are clear. There's no excess drainage of the eyes. The eyes are brown. They're even in symmetry. There's no swelling, no draining, discharge, anything, no redness of the eyes or the cornea, and everything is intact. So next I will be looking at, and this is assessing for cranial nerve 2, the optic nerve, and we will be inspecting also the pupillary constriction. So I am going to take my pen light and I'm going to shine it in the patient's eyes. Open your eyes, please. Okay. And the pupils are equal, round, and reactive to accommodation, and the pupils are approximately 3. And I'm going to have the patient follow my pen light. I am going to be doing it in an H motion. I wouldn't be saying that to the patient. They would be following it with the eyes, not with their hands. Now they're going to follow it inward. And so I tested for convergence and accommodation. Both are intact. Now we're going to move on to the ophthalmic exam, where I'm going to be assessing the patient's I'm going to check for the red reflux. I'm going to visualize the disc, and I'm going to check the vessels, and I will only be doing it on one side. Okay. Red reflux observed. Okay. Thank you. Okay, the lens is intact. The disc is intact, and the vessels and arteries are intact also, and the red reflux was observed in the patient's eyes. And now I'm going to move on to visualizing the head and scalp. So I will be assessing the patient's scalp. I'm feeling it for the distribution of the hair. The color is brown. There is even distribution of the hair. There's no uneven patches, no infestations, no dryness of the scalp. The hair is thick, even, no lesions, masses felt, no sores felt or anything on the patient's scalp, no dandruff, scaling. And next we're going to be assessing cranial nerve 5, which is the trimensual. It's assessing for the sensory, so I will be taking a light pen, and the patient will tell me if they're feeling the end of the pen on their forehead, which is the ophthalmic. Do you feel that?
Yes.
Okay, and then we will be moving on to the maxillary, which will be the cheeks. Do you feel that?
Yes.
Okay, and then the mandible, which would be the jawline. Because the patient has a beard, I'll be doing it towards there. Do you feel that?
Yes.
Okay. Next, we will be testing for the motor, so I'm going to have you clench your teeth. Okay, thank you. And next we will be moving on to cranial nerve 7, which is the facial nerve. So I'm going to have the patient smile, okay, frown, puff out your cheeks, and raise your eyebrows. All observed. Okay. Next, I'm going to palpate the patient's sinuses. Okay. Do you feel any pressure, any soreness?
No.
Okay. Next, I'm going to assess the nose, cranial nerve 1, which is the olfactory. And first, I'm going to assess for the nasal patency first. Okay. And what do you smell?
Coffee.
Okay. And on this one?
Coffee.
Okay. All right. And next, I will be examining the patient's nasal mucosa. Okay. So I'm going to be assessing the nasal mucosa, the septum, the turbinate for any turbinates and any polyps. So it is intact. The septum is not deviated. The mucosa is a red, not red, it's not inflamed, it's a pink. Okay. No polyps observed when I was assessing the inside of the nose. Next, we're going to move on cranial nerve 8, which is the acoustic ventibular ears. And do you have any hearing problems?
No.
Any pain in your ears? Anything that I should be aware of?
No.
Okay, so next we're going to move on. We're going to be assessing the patient's ears. I'm going to assess for hearing, and I'm going to be doing a whisper test. So I'm going to occlude one ear, and I'm going to whisper something in his ear, and you'll tell me what you can hear.
1, 2, 3. A, B, C.
Okay, thank you. Next, we're going to test the middle ear, so I'm going to push on the tragus. Do you feel any pain or pressure there?
No.
Okay, and then I'm going to pull on the auricle up and back and slightly out. And I will be assessing your ear while I'm doing that. Maybe sit forward a little bit for me. The tympanic membrane is intact. The light cone of light is 7 o'clock in position. I'll be assessing the other side. And there is serum observed, and the tympanic membrane is intact. The cone of light is in the 5 o'clock position. Thank you. All right, so next, we're going to assess for the mouth. I'm going to inspect your lips. The lips are intact, they're not dry, there's no cracking involved. Next, I'm going to assess the oral mucosa and the gums, so go ahead and open your mouth. My pen light. Okay. Hard palate is intact, soft palate intact, no missing teeth, no swelling, no discoloration, everything is intact. Next, we're going to assess for cranial nerve 10, which is the vagus nerve, and I'm going to have you open your mouth again and have you say ah. Okay. The uvula is in midline and the palate is intact, as I said. And next, I would assess for the cranial nerve 9, but that is the glossopharyngeal, which is the where we would be testing the gag reflux. And at this time, I'm just going to verbalize that I would do that. Next, I'm going to assess the cranial nerve 12, which is the hypoglossal. So I'm going to inspect the tongue and have you protrude the tongue out, get in and out, side to side. Okay. Cranial nerve 12 is intact, and I would assess the pharynx, and palpate in presence of the tonsils. The tonsils are intact. The patient has them intact, and the pharynx is intact and is pink in color. And next, we're moving on to cranial nerve 11, which is in the neck, and that is a spinal accessory. So I'm going to have you turn your head side to side against my hands. Thank you. And then I'm going to have you shrug your shoulders. Okay. And next we're going to move on to the trachea is in the midline and it is intact. And now we will be assessing the thyroid, which is first is the thyroid, then the thyroid cartilage, and then the cricoid. The cartilage are the landmarks. Next, we're going to assess the lymph nodes, and I'm going to have you sit forward a little bit. So we're going to start with the periocular, the postocular, the occipital, the submental, the submandibular, the tonsillar, superficial clavicle chain, the deep cervical chain, the posterior cervical chain, and then this, shrug your shoulders a little bit, and right in there is the supraclavicular lymph node. Okay? And moving on from that, next we are going to have you'll be sitting, and we're going to be moving on to the anterior thorax inspection. So I'm going to assess for the symmetry of the patient's thorax. It looks like everything is intact. There's no swelling. There's no anything that I've observed looking at the patient's back. And I will sit here and I will assess the patient for, I would assess the patient for 1 minute for the rhythm and the rate. Patient is breathing with ease. Okay, so for 30 seconds, it was 8 times 2 is 16 for time's sake right now. And next we will be moving on to the auscultation of the lung sounds. I'm gonna have you take your shirt off so I can listen to your lung sounds, please. Okay. I'm listening to the lung sounds, and the lung sounds are clear. I don't hear any crackling, no distress noted. Take some deep breaths for me. One more time. Okay, no wheezing, no crackles observed. Chest is symmetrical. Now I'm going to place my hands on the patient's back and have you turn this way. And I'm going to have you say 99.
99.
I am assessing the patient for firmitis.
99.
Okay. Tactile firmitis.
99.
Okay, go ahead. And then I'm going to assess the patient for I'm going to percuss the patient and assess the thorax for resonance. I'm going in a ladder motion. Okay, and there is a normal resonance when I percussed, and now I'm going to percuss the back for CDA. So I would be looking down toward when I am assessing for this. Please tell me if you feel any pain.
No.
Other side.
No.
Okay. Now I'm going to be listening to your lungs for listening to your breath sounds and listening for any adventitious sounds, and I'm going to be doing the Ego-Fanny test. So when you feel my stethoscope press on your back, say E, okay?
E. 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 E.
Okay. All right, now I'm going to listen to the check your carotid roots for any thrills, and I'll be using the bell of my stethoscope. Okay. And also, when I was assessing your eyes earlier, I assessed cranial nerves 3, 4, and 6, which are the ocular motor, trochlear, and abduction mode with the motion of your eyes when your eyes are following my pen for the H. Okay, now moving onwards, we're going to assess for the, I'm going to assess your arteries. Okay, 3, and then the brachial, 3, and then the radial. They're strong. Let's see, those are 4. And then I'm assessing the posterior tibial arteries, and those are 2s. And then the dorsal pedius. There's strong 2, those are 2s, 3s. Now we're moving on to the inspecting and listening to the cardiovascular system. So I'm going to have the patient lie supine. Go ahead and lay back for me. Okay. And I'm going to inspect and palpate for lifts, heaves with the pads of my fingers. And I'm going for thrills also. And balls of my hand. And I'm going to auscultate in all of the 5 areas of the heart, which is the aortic, pulmonic, herbs, tricuspid, and mitral. This is the aortic, pulmonic, herbs point, tricuspid, and mitral. The apical point is where the mitral valve here, and that is where you would hear S1 and S2, both were heard. S3 and S4 were not noted or heard when I was auscultating. I was also assessing no murmurs were heard and no extra sounds. And I will also assess with the bell of my stethoscope on herbs, tricuspid, and mitral. Also assessing for the extra sounds with the bell. No extra sounds observed or heard. And I will identify and palpate the PMI, which is at the apex of the heart. Okay. Next, we're going to be moving to the abdomen. So the patient is going to remain lying supine, and I'm going to inspect for symmetry, any edema, pulsations, veins, hernias. I don't observe anything. The abdomen is symmetrical, and now we're going to auscultate, and I'll be listening to auscultate using the aorta, listening to the aorta, the renal, the iliac, and the femoral arteries. Okay, so I'll start with the aorta. And the renal. And the iliac. And general. Okay. femoral arteries, nothing, I did not hear anything abnormal. Now I'm going to listen in all 4 quadrants of this abdomen. Okay, active bowel sounds in all 4 quadrants. Now I'm gonna percuss the abdomen to see if I hear any sort of epigastric air bubbles or a suprapubic dullness. Okay, no epigastric bubbles heard or suprapubic dullness was heard. Next, I'm going to percuss for the liver, which is on the right side of the patient. So I will start. Did you feel any pain or anything?
No.
Okay. Also, it would be, I'm marking where the patient's liver would be, is approximately there. I don't feel any enlargement. If it was a larger patient, I could use the cupping motion where I would go under the patient's rib, but this is not a larger patient, so I will not be doing that. Next, we're going to have the patient roll onto their right side. And so I would percuss, and I am going to percuss until the sixth and 10th rib, and then I'm gonna have the patient take a deep breath. Take one more deep breath and hold it in for me. Okay, no, I can lean back on your back now. There's no swelling of the spleen, and it is no swelling of the spleen, no enlargement of the spleen, so that is good. Next, I'm going to lightly palpate in all 4 quadrants. Feel any tenderness?
Oh.
No? Okay. And then I'm going to do a deep palpation, which I'll be using 2 hands, and I'm gonna have the patient take a deep breath each time I palpate. Any pain?
No.
Okay. Now I'm going to palpate the superior, inferior, and inguinal lymph nodes, which is at the groin area. Any pain, tenderness? Okay. Next, I'm going to do the McBurney sign, which is testing for appendicitis. So I'm going to press down on the lower left side of the patient, which is right in the, any pain?
No.
Okay. Then we're going to do the Bloomberg sign, which I'm pressing down on the abdomen and doing a quick release. Let me know if you feel any pain.
No. 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 No.
Okay. And then I'm going to do Brudzinski sign, which I'm going to have the patient lift the head of their neck up, and your legs do not come up at all, so that would be a negative test. And next I'm going to have the patient lay down flat. Is the Kernig's test, where the patient is going to lift your knees up and bend them. Put them up like this. And then, does it hurt when you straighten them?
No.
Okay, so that's a negative test for the Kernig's sign. Next, we're going to move on to the musculoskeletal. So I'm going to have you go ahead and stand up for me. I'm going to assess the patient's body. I'm going to look at the skeletal and the extremities. They are symmetrical. There is no muscle wasting, no atrophy observed. Okay. Bilaterally, they are the same. Again, no muscle wasting. So I'm going to also assess the patient's gait. So I'm going to have you walk to heel to toe. And then when you come back, I'm going to have you walk on your heels. And then when you walk back again, you're going to walk on your toes. Okay, and go ahead and walk normal back to me. Okay, normal swinging of the arms, no shuffling. The gait was even and steady. And okay, now we are going to do the Romberg test, where I'm going to have you place your arms down by your side, close your eyes, and I will be assessing the patient for 20 seconds to ensure that there is no swaying of the patient, there's no unevenness, and there's no weaving back and forth. Okay, go ahead and open your eyes. All right, and the patient, that was a negative test for that, so now we're going to assess the patient's range of motion. So first we're going to start with the shoulders. So I will have you do flexion, which is you're going to raise your arms above and over top of your head. Your arms straight. Okay. Now for extension, you're going to lift your arms back behind you. Okay, good. And now abduction is you're going to take your arms to the side and you're going to lift them up and over your head. Okay, back down. Now adduction is you're going to cross your arm across from you. Okay, and the other side. Thank you. Now we're going to do an internal rotation, which you are going to turn your back to the camera, and you're going to take your arm and place it up by your shoulder blade. Okay, and the other side. Right. Okay. And then external rotation, you're going to make a 90 degrees and put your arms down and back up. Good job. Okay. All right, now I'm going to have you sit back down. I'm actually going to have you lie back down because I'm going to assess your hips. So I'm going to have you bring your knees to your chest and put it against your abdomen. Okay, bring them back up. Good. That's flexion, and now I'm going to have you roll over onto your stomach. This is extension. I'm going to have you lie face down, bend your knees, and lift it up. Okay, one at a time. You can lift one leg up. Okay, other side. Good, thank you. Now you can lay back on your back. Okay, now one leg, I want you to lift up and move it away from the midline. Okay, other side. Okay, and now I want you to lift one leg up and cross the other leg. Okay, good. When the patient was lifting their leg and away from their body, that was abduction. When they were crossing their legs across the body, that was adduction. Now we're gonna do the knees. So we're gonna perform flexion. So I need you to bend your knees. Okay, and straighten your legs back out. That's extension. Now I'm going to assess the ankles, and that would be dorsiflexion, which is point your feet toward the floor. There you go. Now point your feet towards the ceiling, which is plantar flexion. Okay, good. Relax. All right. Now we're going to assess the PCL, the posterior cruciate ligament, which I will position on the patient with the knees bent, and I'm going to push on the tibia and posteriorly and observe the degree of the backward movement of the femur. So pushing and pulling. Okay. And then the LCL, which is the lateral lateral collateral ligament, I will, with the right thigh and knee in the same position, change my position so that I can face one hand against the medial. And then I'm going to medial surface of the knee and the other on the lateral ankle. So I will be, and this will help me open the knee joint on the lateral side. I would be feeling for excessive widening of the joint and lack of the endpoint that may signal the ligament is no longer intact. So, and then MDL is the medial collateral ligament with the patient supine and your knees slightly flexed, so bend them slightly. I would move the thigh about 30 degrees laterally to the side of the table and place one hand against the lateral knee. And to stabilize the femur and the right ankle to the knee on the medial side. Okay, that is intact. He does not have an MCL tear. Next, I'm going to be assessing the ACL with the patient supine and the hips flexed, so go ahead and lift your knees up. I am going to, the flex at 90 degrees, feet are flat on the table. I'm going to cup my hands around the knee, and I'm going to put my thumbs in the medial and lateral joint line and the fingers on the medial and lateral insertions of the hamstrings, and I will draw the tibia forward. Okay, and the feet don't move, so that is good. There's no ACL tear. Okay, I'm gonna go ahead and have you sit up for me. And I'm going to perform this on one side. So I'm going to assess the deltoids and lat strength. So go ahead and make like this. No, relax. Okay. Go ahead and pull, push. Okay. And then I'm going to have, and that was about a 5. So go ahead and take my fingers. Grip my fingers, okay, hard as you can. Okay, that's about a 5. And go ahead and I'm gonna have you lie back again. I'm gonna assess the lower extremity for the hip strength. So go ahead and push up, okay. And that was for the hip strength, and also push out, push in, okay. Go ahead. Push up, push down, lift up, lift down. Strengths are all 5. Next, we're going to assess for the deep tendon reflexes. I'm first going to assess the patient's triceps, which is between C6 and C7. So I'm going to have you go ahead and sit up for me. This is above the elbow. Right back here, so I would find it right above the elbow. Patient's arm is relaxed. Okay, it's intact. And next I'm going to be assessing for the bicep, which is below the bicep muscle. I would actually have the patient flex their arm, and I would find it right in there. And then the brachiopatelis, which is right in the wrist, and it is on the radial side, and it's 2 to 3 centimeters up. Okay, it's intact. And next I'm doing the patella, so I am going to have the patient sit so their legs can dangle, and it is right below the kneecap. Take a seat back in the seat. Next, I'm going to check the ankle jerk or the Achilles. It is right behind the ankle, right into that tendon. Okay. And next I'm going to check for the Babinski's sign. So I will take the patient's foot and I will run a tool up the foot. There's no fanning of the toes, so it is negative for the Babinski's. And that is it for my head to toe assessment.